Hello everyone, welcome to my nursing education channel. So today we are going to discuss about the topic that is cervical erosion. So here we are going to discuss about the various topic. So starting with the introduction, cervical erosion is also known as cervical ectropion. It is a common gynecological condition that has no link to cervical cancer or causing health problems. Cervical erosion is a common condition caused when cells from inside the cervical canal, known as glandular cells, which are soft cells, are present outside the surface of the body. It can cause irregular bleeding and pain after sex. It is typically detected during a routine pelvic exam and often requires no treatment unless symptoms like bleeding and discharge occur. So it means that the cervical erosion is a common condition which is caused inside the soft cell, which is known as glandular cells, which are present inside the surface that will present outside the surface. Definition: cervical erosion is a condition that occurs when the glandular cells or the epithelial cells grow outside the surface and form an inflamed area that looks eroded and infected. Incidents: so there are different types of cervical erosion, including the soft, round, which does not require treatment. It can heal by its own. Number 2, irregular or bumpy, which is considered more hazardous, requires treatment. Bleeding on trauma. It is considered more hazardous than irregular bumpy and it requires immediately treatment. Etiology: the causes of the cervical erosion are as congenital and acquired. Pathophysiology: so due to the etiological factors like epithelial transformation, it could be occur inside the cervix where the columnar epithelium extends outside. There will be hormonal influence occur, estrogen, inflammation and infection, HPV, that is human papilloma virus, and the healing and the metaplasia occur. Due to the etiological factors like the congenital and the acquired, which will lead to the inflammation or of the epithelial cells, which is glandular cells inside the surface, and due to the hormonal influence occur, that is estrogen, it will occur inflammation and infection in the surface. So at the end, due to the inflammation and the infection, the healing and the metaplasia occur. There are various clinical manifestations occurs like abnormal bleeding, pelvic pain, light mucus discharge, pain and discomfort, pain when urinating. Now coming with the diagnostic evaluation. So how we can diagnose is, first of all, history collection, physical examination including pelvic examination, pap smear, colposcopy, biopsy, nucleic acid amplification test, and laboratory test. Under management, there are medical management and surgical management. So under medical management, there is a boric acid suppositories. It is administered to relieve symptoms like frequent vaginal discharge or spotting. Another one is silver nitrates. It is used 2 to 4 times a week, which is chemical applied to the cervix to seal off the cells using bleeding. platelet-rich plasma. It is used for the growth of factors from a patient's own blood to promote natural healing. Analgesis. Sometimes analgesis is also used to relieve pain in vagina in the form of suppositories, etc. Sur- Surgical management. There are various surgical management like cautery and cryotherapy. Under this, there are dye therapy where a heated probe removes the top layer of the surface, allowing a healthy cell to grow back. This is an outpatient that use local anesthetic. Electrocautery. Another one is cryotherapy includes the cryosurgery. It is a procedure where extremely cold chemical uses to freeze and destroy irregular abnormal cells in the cervix through vagina. Cryocautery. It is a freezing technique used with a small probes with a metal tip or a cold spray to thread to the cervix. Other treatment includes LEEP, that is loop excision procedure. In this procedure, a loop is using a thin heated wire inserted through speculum to remove abnormal tissue from cervix or to remove infected tissue. Under nursing management, we can do observation, medication, symptom relief, treatment, screening, and other cervical erosion management are stopping estrogen containing medication, using pads instead of tampons to reduce the risk of infection, using condoms after intercourse can be suggested to the patient, health education and psychological support. Prevention, safe sex practices, regular gynecological exam, hormonal management, good vaginal hygiene, and probiotics. Complication, it could be PID, that is pelvic inflammation disease, infertility, chronic pelvic pain, fertilization outside the womb, which is also known as ectopic pregnancy, sexually transmitted infection. So summary, cervical erosion is also known as a cervical ectropion, a benign condition where the lining of the cervical canal, that is glandular cell, is visible on the outer surface of the cervix, appearing as red raw area, often due to the hormonal fluctuation and considered a normal variant in human of reproductive age, while it can be sometimes causes symptoms like bleeding after sex or increased discharge. So coming with the end of the topic, the conclusion, cervical erosion is a common gynecological condition that has no link to cervical cancer. It is a common condition, usually benign, but it is important to know the signs and symptoms of cervical ectropion, so erosion itself is relatively insignificant. However, it may precede cervical cancer. There are different types of cervical erosion and different causes and different diagnostic evaluation. This is a bibliography where I refer of various books like Jacob Andaman and DC Dattas, and this is a journal where I refer